everybody. We are back with session three. With Lindsay and I are here with our guest, Penney Zimmerman. Oh, there's so much in her story. And even though I have known her for like 10 years now, I mean, I'm hearing some things for the first time. And y'all, this is just really a powerful story and miraculous. And she's got these 7-day periods where God just sort of set her aside and transformed her. I mean, it's kind of like those Saul to Paul moments if you read about him in the Bible. And wow, there's just more to this story. So we're just going to dig right in. The first one has to do with, she's just sharing her testimony of what God's done in her life and how he put this on her heart to share her story. And then the second episode we did is she went into her breast cancer story, and then all that happened there. And she's going to pick up with that on some of the treatment and that red stuff that we were talking about. She's going to explain that. And then just where God has taken her to this point. Wow. Okay. So Penney, this one we're going to talk about kind of the treatment and recovery. And there's another cancer story in here. I know that. There's stories that God's just bringing up, memories for her where he's reminding her he's been there all along. So Penney, pick up with the treatment process, what you went through, what you felt, and that other story and that red story and all that.
I have a really good story about the treatment.
Okay.
I talked about the worst of all of, I can't remember every name. I could probably have looked it. I probably should have looked up all the different types of chemotherapy on my treatment. But the main one, the one that devastated me the most was adriamycin, or as most people know, the red devil. It's like pure poison. You're literally putting, that as you watch that go in down that line, and I can't emphasize how hard it is to watch it slowly go down that line into your arm, and know that for the next 3 weeks, you are not going to know nothing but misery, sickness, and metal taste, and ulcers in your mouth, and it's just indescribable. But for 3 weeks, and this is the part that's the worst, for all you women who know about that have these beautiful heads of hair and all this stuff, the part I didn't talk about yet was the part that, well, it was bad, but actually I got used to this part. Your hair starts falling out, and it starts out gradually, few thick, spots, and then you get, like they show on the commercial or whatever, you start finding wads. You go to brush your hair and big wads come out, and then you get to where you got all these patches. Well, I had a friend, and I didn't even realize, we weren't that close and everything, but she would come during this time and visit with me a little bit, and we were totally different. This had to be another God moment. I called them God moments too. I forgot to mention this, my God moments. But she came to my house one night and she said, I know this is going to sound strange, but would you like me to shave your head?
Yeah.
And I thought about it because my hair was falling out. It looked terrible. And it got to be where everywhere you went, you'd leave piles of hair through the house. And, it gets very aggravating. Mm-hmm. And you lose every hair on your body.
Wow.
Or I did. I lost every eyebrow, eyelash, everywhere.
Wow.
Legs, everything. I lost everything.
Wow.
And the first time she shaved my head, she was one of these nature people, very earthy and into, I don't know how to say it, nature and stuff. Mm-hmm. She was awesome. Her God was nature and stuff. Mm-hmm. But she was so awesome when she shaved my head, and so nurturing and stuff. And I knew that was a God moment, because the first time you see your head shaved, guys, I can't describe what it does to you. It's like, I'm an alien.
Yeah.
You feel like an alien. And you rub it and you feel every spot on your scalp and stuff. But anyway, it was a very strange experience, but it was a God moment, that I got my head shaped. And I eventually got used to it. And I did get weak and buy I got to where I would just go bald headed and people knew anyway, I didn't have any hair because I had a pink bug. And what does that tell you when you see somebody in a pink bug and they probably have breast cancer?
Right.
I wanted to mention that as something kind of funny, in the middle of all this agony. But and like I said, my story's long and I'm just trying to hit on the God moments. And there were so many God moments, people he put in my life that maybe I needed to smile one day or laugh or something, And then as I got through my treatment and I finally, after they would give me the big doses of Benadryl and knock me out through the treatment so I wouldn't give everybody a hard time, because by then I was very tired of chemotherapy, very tired of being sick and, in pain. Well, I made friends with some of the ladies that were going through it. And we were like children in ways. They'd have on a Thursday, they'd have an ice cream social like deal. And we got to eat ice cream. Of course, none of us could taste the ice cream, but it felt good on our sores, And my sister and everybody would laugh at us. But it's just the camaraderie, what the word I'm trying to say, friendliness of everybody, because we're all going through the same thing. It's like a bunch of children in the schoolyard, but then, you've got the absent chair and you look at each other and go, but this lasted for a year, probably all the treatments, or over a year. I can't even remember. It was such a hard time for me. My sister, I'd make her go home because she had the children and I'd be sick on my own and stuff. But I learned to adjust to all that. And I just got more and more reserved, more and more isolated and more angry. I was angry for a long time. And then people would say, don't you ever want to meet somebody again or do something? I said, no, I don't want anybody in my life, because of my second marriage, I did, and then when you go through and you lose your breast and you see what happens to other people and all that, I think, I'm not going through that. And then I got mad and decided this is where I made the big mistake. And all you out there, ladies that are just diagnosed or are thinking about getting a reconstructive surgery or deciding whether to just go with I went through buying the fake boobie and got measured. Excuse my French, ladies. I call them boobies. But I got they're really funny, but I have a funny story to tell about my fake breast, boob or whatever. But I went through, I did all the proper things I was supposed to do. I went and got measured, I got the bras, ordered. Back then, now you can get them evidently, because I went and got a new one the other day, ordered. But evidently now you can just get them off a shelf. I'm sorry, that's a little bizarre for me. But way back then, when I first got mine, they measure you and they weigh. I wasn't supposed to have a boob left. I was supposed to have both of mine gone, which I now regret. I wish I'd have told them no matter what, if I passed away during the procedure, but take them both off.
Okay,
Don't leave
you only
me.
had the one.
Yes, I have one left that has caused more problems in my life than even I realized. But this is what I did. This is what I want people to know. And he's put this on me, even though it's very embarrassing for me and very hard for me to tell this story. He wants me to tell this story. But anyway, after I went through all my treatment, I made it through a year of Herceptin. Herceptin is the drug that they gave people like me who had metastatic HER2 positive, all this long term that they give you now during breast cancer of what kind of, I was third stage. I forgot to mention that too, but I was third stage, almost fourth, but they give Herceptin to people to help supposedly them not to have a reoccurrence of metastatic disease.
Right.
It increases the risk, that you won't ever have it again. And at the time when I was on the research study, it was for a year. We had to take it. It was an infusion. You had to go in. It took about 2 to 4 hours to do it. I always tell them, rush it, rush it. But they did it as an infusion. And I couldn't get my port. I had a port. So they would, and my luck, Satan hates me, and he always has since I was born, I think. Steve's, that guy I told you about, Steve Furtnick, he did a good public Facebook thing on how much Satan loves you and how long God has been taking care of it, you know, for his soldiers. But I couldn't get rid of the port I wanted to, but my port, they could put stuff in me, but they couldn't do blood draws. And a blood draw, when you're doing chemotherapy and stuff, they take a lot of blood to check your blood to make sure you're not anemic or you're not hyponatremic, which is low on sodium or low on, you know, because let me tell you, chemotherapy devastates your body. It kills your body. It's not supposed to be in our body. What they do to kill these cancerous evil things, I call them evil cells, you know, it's hard to even think about it, but I think cancer is evil anyway. It's Satan, his way. But, and to put this chemotherapy in our body is like putting pure evil in our body. It kills everything, the good stuff, the bad stuff, everything. It's not the cancer anymore that mostly kills people, or this is a personal thing for me. It's not so much the cancer, it's the treatment. I think cancer is where the saying came from that the cure is worse than the disease, because it is. You know, eventually the cancer would kill you because it would eventually eat you alive. But believe me, chemotherapy kills you a lot worse because it takes all the good stuff. You start getting infections. Well, anybody knows that when you take an antibiotic, you know, sometimes you can get the infections from that. I know what the word is, but my mind just went blank. You know that you have to, it kills out too many good bacteria along with the bad. So that happens a lot during chemotherapy. So you're constantly getting this drug, or I had infusions of iron because my iron got too low. I had fluids because I got dehydrated from throwing up too much. You know, all of the people that are going through chemotherapy, any kind of treatments, and not just cancer, other treatments, you know that sometimes the medication and all that to treat the disease causes other problems, complications. And I had all of them. I mean, chemotherapy, Adriamycin, the Red Devil, was one of the strongest chemotherapies there are. I feel sorry. My heart goes out to anyone that's having to do it. And hopefully that things are easier now. And I've heard that the drugs are not as bad. They even have pill form chemotherapy now. They have pumps that, you know, people can do and still work and all that. I wasn't one of those lucky ones back.
Well, let me ask you this, because you were saying you made the mistake. What would you do differently? What I wanted to make sure everybody knew what I thought was a mistake. I mean, obviously God took care of it anyway.
Okay. Are you ready? One of my biggest mistakes during the treatment. Well, I talked about this a little bit in the past, you know, when I did my first part. But when you're diagnosed with cancer stuff, please take the time to get over the shock and get more than one opinion. You know, do consults. Don't do the first thing they tell you to do. Take your time, think about and get, you know, don't just ask why, ask what is going to happen if I do this. What are the complications? What, you know, is there people I can talk to that have already been through this? Do that, you know, take your time. Let that diagnosis sink in. Let all the treatment plans and talk to get different ideas, different. Don't take the first decisions. Don't do what everybody's pushing you to do real quick. Because trust me, cancer is not going to kill you overnight. It will eventually do it. But, you know, take the time to decide your treatment and you make the decision. Don't let anybody else. I just did whatever the doctors told me to do. And if I could change that now, I would. Because I would have taken longer between when I had the pneumonia and when I had the surgery. I would have, and the biggest mistake I made during the last 17 years with my treatment is I got angry after I was trying to talk about when I got my fake breast and started wearing it. They're very hot, very uncomfortable. They're very hard to get used to. And I was one of those, I was angry. I took mine off and threw it away. Well, not literally away, but let's put it this way. I quit wearing it.
Yeah.
I said, this is it. This is what I am. I'm going to die eventually because it's going to come back. And, you know, I was very angry and devastated and getting used to everything.
Now,
But
I'm not, let me clarify. I'm not laughing because, no, let me tell you why I'm laughing. I'm laughing because you said you threw it. And
that's why I want you to laugh.
Where did she throw it? Did she hit somebody in the head with it? Did she throw it in the trash can? That's why I'm laughing. Okay.
Yes.
Not because of what you're going through.
I got very angry one day and it was hot and it was slipping and it was very uncomfortable. And I wore it I really did. I tried for 6 months to get used to it, you know, but it was during the summer, it was hot. I took it off and threw it in the garbage outside.
Okay. Okay.
I had to eventually go back and get it and wash it. And it's made out of this spongy stuff. Anyway, you know, it was a joke too. I told people, would you like to, you know, I don't want to get into that. That's kind of
So Penny, let me ask you this. Okay, so when they were talking about like the reconstructive surgery and all that kind of stuff, so you bypassed that and then just got
yes.
raw that
Yes.
Okay.
Well, that, you know, they don't do, most of the time, they can do the reconstruction at the same. I did have a friend that had it, but for me, I was between the pneumonia and all that, my whole treatment was, everything was messed up because I got sick and everything, it put everything off. So when I got the fake breast, I decided I would put off, you know, because I'd already went through the breast surgery and chemotherapy was about killed me so many times that I was not really strong enough for another, and it, believe me, it's a major surgery.
Yes.
I'm talking major surgery.
Yes.
You know, in fact, I don't know that it wouldn't be worse than taking it off when they go to do the reconstruction.
Yeah.
Some women, I know women that just had like a lumpectomy or had a piece and they could just put in the implant and it wasn't a major. But for people like me, where they had to take the whole breast or both, you're talking major reconstruction.
Mm-hmm.
And depending on the type, and that's another thing I'd like to mention, there's different kind of breast reconstruction. Some are more, you know, invasive, more, you know, than others. So be careful when you're doing that. Decide what's best for you. Don't let somebody else tell you. You decide. You hear everything they have to offer. Go to different doctors, which I'm doing now. I'm fixing to start because I'm thinking about having reconstruction now. And I'm going to go, this is why my biggest mistake I made. And now I'm going to try to correct it. The Lord's put it on my heart to try to correct it. Not for vanity. Don't get me wrong. What I'm fixing to tell you is not for vanity. I have no vein in me anymore. You know, I've been through too much. Yeah. But about 7 years ago, when I threw my breast in the garbage, and then I put it up and quit wearing it, for years I never thought about it again. And my doctors didn't either. Nobody recognized it until probably about 5 years ago. I thought I'd had back problems before, so I thought my back problems were just getting worse. What I did when I threw that boob away and when I put it up, I caused my body to be off balance. Nobody caught it in time for me.
That's interesting.
So, yes, and this is another thing I want to tell you, ladies. Either or even, I don't know, men, I don't know if men have breast reconstructions or whatever. I know they do get breast cancer, but please make sure that you have some kind of, I don't care how you do it, either reconstruction or a fake breast or whatever, wear it. Please wear it. Don't do what I've done all these years. Because I took mine off and I didn't wear it, my body went off balance. And it was such a gradual off sides that my spine started going, my left was where my surgery was. My spine is going to the right. Wow. It caused me such a lift to the right that now I walk with a cane to keep me, to try to straighten up.
Wow. Wow.
Yeah, that has been a big thing for me. So when I came out of this last thing, well, first let me tell you about my next part, which is when I finally got to where I was cured, my hair was back. I was trying to get stronger and trying to recover. You don't recover from chemotherapy in a year or two. I don't know that you ever totally recover, but after about, I'd say 2012, I started getting to where I tried to live some normal. I was cleaning people's houses, just to have stuff to do, friends' houses and stuff. I'd mow my friend's yard because I was bored. Because I'm a worker. I've always been a worker, and this has been very hard on me. I'm always doing something. I'm always doing something. If a neighbor needed something, a yard mowed, I'd go mow their yard or whatever, trim trees, whatever, just something to do something. I really didn't do it just for the money because, I didn't have very many needs being hidden, but the Lord would try to, he'd put somebody call me and say, hey, are you busy? No. What do you need? And I'd say, okay, I'll do it. He always kept me busy. He always put people in my life to bless me when I needed something. Mm-hmm. I have a friend through 17 years. She lives in Decatur. She's French. I told you she's from France. We worked together. And the first years after I had breast, you lose your job, there goes your insurance. And this is another thing I want to talk about, the finances, if we have time, that I meant to do a while ago, before I get to the lung cancer. But I called them Penny's angels. The Lord put me in that job for a purpose. Mm-hmm. And you're going to think this is a big God moment for me, people. And I didn't realize it, but he showed me this. February 5th was when I was diagnosed with breast cancer. January 1st, my long-term disability insurance went into effect for the first time of 2005, 1 month before I was diagnosed with cancer.
Wow.
That's a God moment if there ever was. That in my car, But yeah, I wouldn't have made it that first year. I probably, after you lose your job and you're devastated, you don't care anyway, but my friends paid my bills. They bought my groceries. They paid my COBRA payment of $1,200 a month until I could get my short-term and long-term disability going, because it takes a couple of months. They paid all my bills, fed me, everything. These people that I worked with, I call them Penny's angels. And I have an angel with their name, and they sent me cards. They sent me generous gifts. They brought things you can't imagine. And they knew me only for 5 years. Some of them didn't know me that long.
Wow.
But they blessed me. I have boxes full of cards, and they were always there. They, even in 2 years while I was going through my chemo, they'd have birthday parties for me. They were the most amazing people. And I still know them. We don't see each other as much, but I just wanted to say that before I go into my next phase, which
and I hope we're gonna they get to see this. I want them to hear your story and be encouraged.
I do too.
They played, but yeah, go into the next thing. Tell us, there's a little bit more to your cancer story.
Oh, yes. Yeah. Just when I thought I was getting back on my feet, getting strong again. But let me tell you something. I'll be honest with you. I smoked most of my life. I smoked for 45 years, even through the breast cancer and everything, which was stupid. And if I had to do that again, I would not. But I enjoyed it. I have to admit, I'm honest. Lord says, be honest. And I'm telling my story, so I can't leave that out. I smoked for 45 years. I smoked through my breast cancer treatment. Sometimes I think that was the only way I make through part of it, and stuff. But even, they say now they can give you, I guess, marijuana to help with the nausea and stuff. But I wouldn't do that, I thought I smoke enough. I don't want anything else, But I got sick again. And I thought it's either cancer from my breast cancer. I started getting sick again with coughing and just, after you go through all this, when your body ain't right. It just wasn't right. Something was wrong. So I asked Dr. McGee, and I saw this special when I was going to CCI, because I had to go every year. Well, it started out every 6 months, but every year I have to go for PET scans, CAT scans, because they're still looking for, secondaries and stuff, even though I took that Herceptin. And he says, now I can wait, once a year. I only go once a year now on that. But I was there doing my checkup and all that, doing my lab work. And I saw this sign that said a VQ scan for long-term smokers. I said, Dr. McGee, you need to order me that. Something's wrong. Well, sure enough, he called me 3 days later and said, I need you to come to my office at 2:00. I said, oh no, I already knew. I knew. And he looked at me and said, well, Pat, he says, we have cancer again.
Wow.
And when was this?
This was September 2017. It was 12 years later. I thought I was okay and I was going to be able to live again, you know. And oh, I'm sorry. I'm distracted because I have Christian music in the background. And I can only imagine.
Yes.
But anyway, and I was in his office and he told me, he says, you have cancer again, because I'd had a VQ scan. I didn't even have a biopsy yet. He says, it's cancer. You know, we don't doubt it a minute. And he sent me to the next phase, a surgeon. Then I went and had the biopsy, which was very painful. It was worse than the breast one.
I've heard that is very painful.
If you saw, I almost passed out just from seeing the needle.
Yeah, no, those needles are long. I have had
And
one.
then I told him, I
They
said,
don't numb you? They don't numb you at all?
oh, no, wait, I'll get to that funny story. That's kind of a funny story.
Oh,
I
okay.
told him, I said, if you come at me with that needle, I am a needle phobic and I'm going to hurt you. So they gave me something that relaxed me and kind of put me in la la land.
Yeah.
Oh my God, you guys. For 7 days, I swear, he must have hit a nerve or something. I was in agony for 7 days after that biopsy.
So sorry.
It was awful. It
Do
was terrible.
they go through like your rib cage or they go through your back? Where do they go?
I think he bounced off a rib when he went through. They go into your side with this. I mean, when think about the needle, into your lung. And of course, it comes back, you know, lung cancer. Primary, not the secondary, because I thought it might be secondary because of the breast cancer. No, this was primary and it was a smoking cancer. It wasn't the old cell that's the fast growing that most people, you know, mine was the other one, the non-adenocarcinoma.
Okay.
So, but it, you know, so in the next phase came, I had to go, and this was the worst part. I had to have another major surgery. But this was, you know, it was hard for me. It was hard for me. I had to decide, do I want to fight again, you know, and probably go through chemo and all that again? You know, it'd been 12 years since the other diagnosis, and I knew what was coming. You know, it's harder when you know what's coming and it's not the first round, you know. So I had to make a decision. My sister says, you have to fight. You have to fight this. You can't, you know, quit. I said, I can't quit. I really can't, you know, but the Lord put it on my heart. And I know now that he did. He wanted me to keep fighting. So I went into major surgery, and what they do with lung cancer now, you know, they cut your throat and to get in to put all these lines and everything into your lungs to get ready. But I'm out. I don't know this, thank God, because I told him, whatever you do to me, I can't be here. I have to be somewhere else.
Right. That's
Because if you come at me with a needle, you can come at me with a scalpel, but you better not come at me with a needle, you know. I'm sorry, people, I'm a wuss. I'm terrible about needles. I can't stand it. And I have to have needles all the time.
I know.
They made it's almost a foot long incision on my right shoulder. Where they go in through your back. And then when they went in, they cut a nerve in my arm. So I've had a lot of trouble with my arm and the nerves, and I lose feeling in my hand. And if I got a glass or anything, I'll drop whatever I'm doing with it. So it's caused a lot of problems. But when they went in, they found out that they thought I only had cancer in the bottom lobe of my lung. On your right side, you have 3 lobes. On your left, you only have 2. So they went, I didn't learn that till after I had cancer. So when they went in and they took out the bottom lobe, the lower lobe, well, they found out I also had cancer in my middle lobe. And I had some lymph nodes that had cancer in it. So by the time they were through taking everything out that was cancerous, I had 1 lobe left in my right side.
Wow.
Yeah. So I lost 2 parts of my cancer. If you're smoking, people, I know it's great because I still sometimes want one. And I've been quit for almost 5 years. Stop smoking.
How does that affect your breathing ability right now?
Oh, I'm getting to that. You're going to love this story. This is a big God thing, or the big guy thing, as I call him. But after I came out, I went home after, the normal pre-op and all that. I had a lot of problems, complications. Well, I had to go back in. I was home for 2 days and my lung collapsed. My left lung collapsed. And they come to find out I had an air leak.
Mm.
What was the lobe that was left in my right side, there was an air leak. So they had to put more tubes in. I was in the hospital a long time and I lost down to 130 pounds. I didn't think I was ever going to get out of the hospital.
Wow.
When I finally came home, I was supposed to have, and this is where it gets, interesting. I was supposed to have chemotherapy and radiation. I was too sick. I was too weak. They didn't think I'd survive, I finally got all the tubes out. Oh, no, I'm sorry.
Don't worry about it. It's okay.
Yeah, but it'll. Ooh, I'm sorry, but
We're real here. We'll just talk over it. You were
okay.
supposed to have chemo and radiation.
And radiation. But when I came out of the hospital and came home, I was so weak, guys. I don't know how I even lived. My sister had to stay with me for 2 weeks and they had to give me injections into a port that I left the hospital with. They had to give me antibiotic injections to, protect, because I'd had pneumonia while I was in the hospital. And so many, I was in the hospital almost a month and a half. And when I got home and they had to keep giving me the injections and stuff for 2 weeks, she had to stay here with me. I was so weak, I couldn't do anything. I couldn't even feed myself. That's how weak. I had lost down to 130 pounds. And I really didn't think I was going to survive that, even after I got home, But I made it through all that. But then Dr. McGee decided I couldn't do the chemotherapy and the radiation.
Okay.
So I'm under close observation ever since then. Every 6 months, I have to have scans and stuff with him. He says if I can make it 5 years without a reoccurrence, that I can go up to a year now and just have both my breast cancer and my lung cancer checkups at the same time, So
And that was a gift from God that you had to go through chemo again, because we already know that was brutal on your body. I mean, I think that
I
was.
wouldn't have survived it. Even my oncologist said I would not have survived chemotherapy and radiation again. My body had been too beat up from before. He knew I would not survive it. He said, you need it, but you won't survive it.
So they removed 2/3 of your right lung. Okay.
So I only have a third left, but now I want you to get to the big God moment. So for the last, let's see, that was in 2017. I started, it's been a tough fight to come back and do anything. Most of the people in my neighborhood know they don't see me as much outside or whatever, but it's so strange. And when I go back for my checkups, every 6 months, I do my scans and I pray and, and my sister says, I don't know what you're worried about. You're not going to have cancer again. She says, God told me you're never going to have cancer again. I said, that's great, Lisa. That's awesome. But people that have had cancer know that it's like a little guy the Satan sits right here and he says, you don't have it right now, but I got 6 more months before your next one.
Yeah.
Oh God, I'm getting company, guys. But oh God, now I forgot what I was going to say about that. My God. Oh my God moment. I got it. All right.
Okay.
Okay.
Let's say that.
I'm sorry. He just, but I had my checkup after all this last November episode. I had my checkup with my lung specialist. And he said that I was a walking miracle.
Yes.
Yeah.
I did some breathing tests. I'm breathing more than I should be able to at more levels.
Wow.
Since November 18th.
Yeah.
But I'm interviewing. But yeah, He says I'm a walking miracle.
Yes.
You are.
Had
Yes.
any chemo and no radiation.
Yes. Yes.
So he was my doctor was so excited. He said, you shouldn't be breathing this good. I'm going to use your case study. This is just awesome. You're a walking miracle. That's not my words. That was his.
Yeah.
And we know that to be the case. I mean, yeah. I mean, God's made you like the Energizer Bunny, you know. But he had a purpose.
Yeah.
Well, and you look the picture of health. I mean, you do not look like what you've gone through at all. And that's God's grace and mercy.
Oh, yeah.
We were talking earlier about how you have to tell your testimony. And I was telling you all earlier that it reminds me of the woman who touched the hem of Christ's garment. And he could have left. He could have kept going to Jairus's house. But he stopped to give her a moment to give her testimony. And so that's just a lesson in listening to you and knowing that this is the first time that you're giving your testimony. God has made a provision for you to give your testimony through Meet Me in the Middle. Thank you, Jesus.
Yeah, that's right.
Because to sit on that, you can't. You got to tell the glory of God. You got to tell other people what he's done for you.
Yes, you do.
You know, and so we just thank you. We thank you for sharing and feeling so honored that we're the first ones to hear it.
Yes. Thank you.
Be able to share it on social media so that we don't know who it's going to reach. We don't know where this spread of seeds is going to reach to across the world, because we've got people across the world watching this. And so we just thank you. We praise God with you and we thank you. And again, you don't even look like what you've been through, but that's what God does. He transforms.
And he is. I am totally different. I'm a different person than I was before November 18th. I am totally different. And the rest of my life, I am going to dedicate to helping people. And I hope that anyone that hears this story shares with other people their experiences. Everybody has a story and they need to tell and share God's love and all the wonderful things and all the wonderful people. I've had so many wonderful people, and I thank them all that have come into my life and have helped me. They know who they are. Mm-hmm. All my Penny's angels, all of them.
I love Penny's.
Thank you. And I thank you guys for letting me share my story, and being on your show I hope it helps a lot of people. That's what I hope and I pray that it does. If it touches one person and helps them in a time that they need, it's worth it all.
Yeah, absolutely.
Thank you guys.
We're going to share this far and wide and, trust God to do what only he does. Everybody needs encouragement and everybody goes through something. So if we can get the one thing that I have gotten hugely out of these segments is God showing you that he was always there. Even when you were angry, he didn't condemn you when you were angry. He didn't say, I'm done with you. You're making me mad now. He continued to stay with you and love you and heal you. Let me just say, even in your time of you are me.
Yeah, because I was not a very easy patient. I'm a very stubborn, very independent person. Sometimes I was terrible. I don't know,
That's why they had to knock you out.
It's true. My sister can tell you a lot of funny stories, but we don't have time for that. My story is long. All the things I've gotten into, and my personality is, very independent.
But you know what, Penny? You're smiling, and that's because of the love of Christ and that transformation in that 7-day comatose.
That's right. Because something I can't tell you what happened to me in that 7 days or the previous. I've had a lot of near deaths in the last 17 years, but I can't tell you what all happened to me. The first one I can, but not that last one. I don't know what happened, but I came out different immediately. you know.
So I will
Just-
say this, because I know you told me that God has put on your heart that you've got to keep sharing your story. So for any of you out there listening, if you want Penny to come to your group and share her story, I feel like I can say with confidence that she is willing to come. So you can get in touch with us through Meet Me in the Middle. You know, we've got a YouTube page. We've got a Facebook group page called Meet Me in the Middle. So you should be able to contact us either one of those places to get in touch with us. Oh my goodness. And have her come to your church or your organization or your group, because everybody needs encouragement for whatever they're going through. And Penny, I mean, so because I can see Penny's house from my window right here that I'm sitting at. I mean, just about, I can see her shed anyway, her she shed. And I can tell you, this woman is a changed woman and a miracle, and she's living out what she has said to us here. And she's a huge encouragement to me and my husband, Roger. She prays for us. And don't forget, Lindsay's going to be looking for that chocolate gobbler.
And she will get it. I will let you know when it's ready. Yeah. Yeah. I was about to put that recipe up, but I guess I'll make it one more time this year.
Yes.
Take it right out of it. It's all yours, Lindsay.
Thank you guys for allowing me to be on your show and everything.
Oh, thank you. It's been our pleasure. It's been our
very
pleasure.
nice to meet you. Yes.
So nice to meet you.
I just wish I could have told more, but we don't have that much time.
Well, we may pick it back up another day, but oh my goodness, thank you so much, guys. We are going to sign off.
God bless you.
Just share all 3 of the episodes, because there's a little piece of the story threaded all the way through, and it's a story worth listening to. I love, and Penny is still living it out. Let me just tell you.
And if there is somebody that personally wants to call me that it's just found out, or give them my number, or my email or whatever, and I'll be glad to talk to them. Thank you, guys. God bless you.
All right.
And God prosper you, and God heal us all. We need all need healing.
Yeah. And we'll see you next time on Meet Me in the Middle.
Okay, bye-bye. Bye-bye.